I now give the floor to the distinguished representative of Russian Federation.
President, we are grateful to the UN Secretary-General for the comprehensive report on how to boost cooperation to counter the transmission of HIV and provide social and medical support for those living with it. The Russian Federation is strongly committed to the goals and principles of the political declaration on HIV/AIDS from 2016 and believes that it is an important instrument to mobilize international efforts to fight this infection. We share the report's assessment of progress at the halfway point towards achieving the 2020 fast-track commitments to eradicate this epidemic. We welcome the recent results in terms of countering transmission of this epidemic, including providing more testing and more antiretroviral therapy and reducing vertical transmission of HIV from mother to child. We note the gradual decline in the number of new cases of infection. We support the idea of the importance of ensuring that those living with HIV/AIDS receive social protection and services on a local level, as well as increasing the funding for these measures. The recommendations focused on achieving the 90-90-90 indicators and preventing related infections and diseases are as relevant as ever. President, we share the view of the use of treatment and prevention of HIV/AIDS and using approaches that focus on specific geographical regions, countries and groups. We believe that this is a key component of winning the fight against HIV. Also, we noted the comments on the need to overcome social, economic and cultural barriers, which, in some cases, can impede access to medical services. We are convinced that this issue is certainly important. Here it is important to take into account the rights of all people, though clearly reflecting the religious, cultural specificities of countries and in compliance with their national legislation, as enshrined in the political declaration of 2016. We were interested to read the data on the combined prevention, including the controversial practice, including the concept of harm reduction, which is not universally recognized. Statistics in the report on programs for syringe and needle exchange and the use of opioid replacement therapy are directly linked to a fall in the number of cases of HIV infection. The conclusion is made that this is effective in solving the problem of drug use and drug-related crime. In this connection, we would like to receive scientifically proven information about how a distribution by a state of banned substances can lead to the prevention of drug use. We believe that a key public health challenge is not only reducing the harm linked to drug use, but also stopping non-medical drug use completely. In our view, treatment of opioid dependence through replacing one drug with another fundamentally contradicts the science-based approaches to prevent and treat drug dependence. In the part on providing young people with the skills and knowledge to protect themselves from this virus, focus is made on broadening access to sexual and reproductive health services. We believe it is vital to create an environment where young people feel able and ready to ask for help. Also, it would appear the aspect of HIV prevention is not completely clear. Here, we should pay greater attention to preventing high-risk behaviours, not limited to simply medical measures to fight against the transmission of the virus, but also cultivate a more responsible attitude among the population to their own health. President, we support an integrated approach to considering the issue of fighting this epidemic, as well alongside other diseases. According to official statistics, those living with HIV are 20 to 37 times more likely to catch tuberculosis than healthy people. We trust that this aspect will be reflected in the outcome document of the United Nations General Assembly high-level meeting on ending tuberculosis on the 26th of September. President, the Russian Federation attaches great importance to the fight against this epidemic on a national and global level. In our country, we are implementing a state strategy to counter the spread of HIV, and we have a comprehensive approach to providing medical assistance to HIV-positive people. We have technology focused on social adaptation and rehabilitation, measures for social support, and there is a widespread information campaign. In 2017, HIV testing was done by a record number of citizens, 34 million people. A whole series of measures to fight HIV infection, including prevention and prophylaxis and medical provision, are all free of charge for Russian citizens. In 2017, antiretroviral therapy was received by 320,000 patients. In order to create a discrimination-free environment as related to HIV infection, we have planned on making changes to the list of diseases, the carriers of which cannot adopt or foster a child. President, a significant achievement made by the Russian Federation is that in our country we've practically halted vertical transmission of HIV from mother to child. Amongst the children in our country, we have achieved the indicator from the 90-90-90 strategy. In April, in Moscow, with the support of the Russian government, we held the 6th International Conference on HIV/AIDS in Eastern Europe and Central Asia. This forum was a key platform to develop cooperation and exchange experience in this field in countries of that region. The discussions focused on 4 areas: science and medicine, assistance to international development, effective prevention, and involving civil society. And the outcome of this forum, we adopted a declaration which reaffirms our commitment to the SDGs, specifically the SDG to put an end to HIV infection by 2030. I thank you.
I thank the distinguished representative of Russian Federation